Today topic is infertility and ART. Infertility. ART means assisted reproductive technology. First we discuss what is infertility. Here infertility means inability to conceive, or simply we can use inability to produce children. Reason for there are several reasons we have for infertility. I will discuss each type in detail. Yeah. So first, physical reason. Physical. Here physical means structural abnormalities or blockage in the reproductive tract. For example, blockage in fallopian tube in female, blockage in fallopian tube in female, or duct abstraction in male. Here duct means several ducts we have in male reproductive system. So if any abstraction which occur in duct, that also leads to infertility. So these are physical reasons for infertility. Now we move on another reason for infertility. The second reason, congenital defect. A congenital defect means reproductive disorder or defect present right from birth. By birth, if any reproductive disorder or defects are there, means it comes under congenital defect. Here we have a few examples for congenital defects. Yeah, for example, for congenital defect, Klinefelter syndrome. Klinefelter syndrome. So this Klinefelter syndromes, which in male due to extra X chromosome is added. Generally, male has 44 autosomes plus XY chromosome generally, but due to addition of one extra X chromosome, it become 44 autosome and double X. So generally, human chromosome has 46, but in this case there are 47. So this 47 due to addition of one extra chromosomes. So this condition is called Klinefelter syndrome, which generally appear in male. So this is one of the defect which comes right from birth. And this condition is called it is an abnormality of chromosomes. And one more example for congenital defect, that is Turner syndromes. Turner syndrome. So generally these Turner syndromes which occur in female, and it is due to deletion of one X chromosome, female. So generally female has 44 autosomes and X chromosomes. So total 46 chromosome will be there. But due to deletion of one chromosome, X chromosome, then the number will become 44 autosomes plus only X. So 0. So we have only 45 chromosomes in this condition. And this condition is called so this monosomic condition is known as Turner syndrome. So this Turner syndrome is occur in female. So this is also one of the congenital defect which comes right from the birth. So these two are important example for congenital defect. And we move on another reason for infertility. So that is drug abuse. Yeah. Third one, drug abuse. So drugs here like alcohol or tobacco chewing or intake, alcohol or tobacco intake, which affecting the gamete qualities, which are affecting the gamete. Here gametes are nothing but in male gamete, here male gamete is sperm and the female gamete here, female gamete is ovum. So this ovum also called egg. So due to chewing or alcohol drinking, they'll affect the gamete quality. One more important causes or reason for infertility, that is mental stress. And the coming to fifth, it is very important, that is immunological defects. Immunological problems. Here immunological means include here immunology, body producing antibodies. Generally our own body produce antibodies against pathogen. Here body produce so the produce antibodies which act against its own gametes, which act against its own gametes like sperm gamete or ovum gamete, and it destroy it, and it destroy or kill these gametes by our own body produce anti. So this is the before fertilization. All this destruction of gametes occur before the fertilization because of our own body produce this anti. So this is the one of the important reasons of infertility. And one more important infertility reason or problem or causes are physiological abnormalities. Very important. Sixth one, physiological abnormalities. Here, physiological abnormalities include severe emotional stress, which include severe emotional stress and anxiety or mental health factor. Some mental health factors. So these factors which all these factors which alter the hormonal balance. This hormonal balance which regulating the fertility. Like generally this hormonal balance hormones which is essential for fertility start from generally hypo produce gonadotropin releasing hormone, and these due to this severe emotional stress, anxiety and mental health factor, and which disturb this hypothalamus, and then it stop the releasing of this GnRH, gonadotropin releasing hormone. Not only hypothalamus, also which impact or which affect the pituitary gland. So in pituitary gland, generally anterior pituitary gland, which produce two different kinds of, which is related to the fertility, like LH hormone and FSH hormone, luteinizing hormone, follicle stimulating hormone. So these two hormones also essential for fertility. So due to this problem, and in pituitary gland hormone also they get disturbed. And also not only that, and gonads hormone. Here gonads hormones are nothing but, generally gonads are testis in male and ovary in female, and these testis and ovaries they also produce their respective hormones. For example, testis produce testosterone hormone, and ovaries produce two different kinds of hormone. Mainly they are progesterone hormone and estrogen hormone. Progesterone and estrogen hormone. And all these different hormones, they are produced from different glands, and they get disturbed due to this problem. All these abnormalities due to physiological abnormalities. And so by this we discuss each and every reasons for infertility. Why infertility occur means due to all these reasons. And now we move on very important concept in this chapter. So that is, this infertility can be cured. Can be cured with the help of ART. ART means assisted reproductive technology. Now we will discuss each and every ART, how we use this ART to cure this infertility problem. Generally in ART we have two different types based on the fertilization taking place or outside or inside of the female body. So two types. Yeah. There are two types or two methods. One is in vitro fertilization and one more is in vivo fertilization. Here in vitro fertilization means fertilization takes place outside of the female body, in which fertilization or fusion of gametes occur outside of the female body. And after fertilization, there is a formation of zygote, and zygote later develop into embryo, and these embryo later transfer in vitro fertilization, later transferred into female body. So that concept is called embryo transfer. Simply we can use ET. It means that after fertilization, then it followed the ET, embryo transfer. And coming to in vivo fertilization, this in vivo fertilization means in which fertilization which occur in outside of the female body, in which fertilization are also called fusion of gametes, where male gametes is called sperm and female gamete is called ovum, which occur within the female body. So that is the major differences between in vitro fertilization and in vivo fertilization. Generally, we will move on in vitro fertilization. This in vitro fertilization, IVF, simply we can use the term IVF. In this in vitro fertilization, also known as test tube baby. Do you know the world's first test tube baby was Louis Joy Brown on 25th July 1978 at England or United Kingdom. And this first test tube baby was created by two different scientists. Here I am writing two different scientists. Yeah. So test tube baby was created by here. Test tube baby here, Louis Joy Brown on 25th July 1978. And this was created by two scientists. They are Robert Edward and one more scientist, Patrick Steptoe. Hence, these two scientists together called as a father of IVF or test tube baby. And we move on, and it is all about the world's first test tube baby, that is Louis Joy Brown. Now coming to India. In India, first test tube baby. In India, first test tube baby was Kanupriya Agarwal, and her nickname is Durga. And it was created on 3rd October 1978. 3rd October 1970 in Kolkata, West Bengal. And this was created by a scientist, Dr. Subhas Mukhopadhyay. Hence, he was known as the father of test tube baby in India. Subhas Mukhopadhyay, known as father of test tube baby in India. So this is all about the various scientists they perform test tube babies in world. These two scientists, Robert Edward and Patrick Steptoe. In India, Subhas Mukhopadhyay, and he created Kanupriya Agarwal, and her nickname is Durga, as a first test tube baby in India. And in world, the first test tube baby is Louis Joy Brown. And hence, these two scientists, Robert Edward and Patrick Steptoe, is known as the father of IVF or test tube baby. Now, we move on. Different types of IVF, in vitro fertilization. Yeah, types of IVF. We have two different types of IVF as per NCERT. Two different types. Now we will discuss these two different types in detail. Yeah, one is GIFT and second one is IGIFT and IUT. So here GIFT means zygote intrafallopian tube transfer. IUT means intrauterine transfer. Intrauterine transfer. Yeah. So in name only it suggests here the formed zygote, it is transferred to the fallopian tube, in which zygote or early embryo means here the embryo with 8 blastomas. Embryo with less than 8 blastomas. Less than 8 blastoma transfer to the fallopian tube of the female body. Here fallopian tube, nothing but it is a female reproductive organs like this. If you observe, if you draw the female reproductive structure, it has various parts. See, it is a uterus part and cervix and vagina, and here tubes, two tubes. Yeah. So here we have ovary, pair of ovary. Yeah. So this is the reproductive part of female, in which here vagina part and this one cervix, and this is the part called uterus, and this two tube-like structure part is called fallopian tube, and the most important part, it is the primary sexual organ in female reproductive system, that is ovary, and this ovary produce ovum or ova. And here in GIFT, the formed embryos, early embryos or zygote, directly we transfer into in this fallopian tube. So later from this embryo, then which attached to the uterus of the here, then it attached to the uterus. So like that process will occur in GIFT. Now coming to intrauterine tubes, here in which the formed embryos are embryo with more than 8 blastomeres are transferred to uterus. Here name only suggests uterus. Transferred to the uterus means in which method we can directly transfer more than 8 blastomer stage of embryo into the uterus in this region, uterus. So here we can transfer the embryo with more than 8 blastoma. Such method we can use in IUT, intrauterine device. So here in these two methods, the major differences is only two. In GIFT, we can transfer embryo with less than 8 blastomer stage, and in IUT, we can transfer embryo with more than 8 blastomer stage. This is the first major differences. And one more difference is in GIFT, we can transfer embryo in fallopian tube, but in IUT, we can transfer embryo in uterus. So this is all about the different types of IVF. Different types of IVF we can use. Now coming to one more important method, another method of ART, that is in vivo fertilization. We will discuss now. Yeah, here second method, yeah, in vivo fertilization. So here in vivo fertilization means fertilization or fusion of gametes occur within the female body, and in which formed embryos after fertilization the zygote will form, then this zygote develop into embryo. So that embryo, that is formed embryo, the formed embryos can also be transferred into the females. Here embryos are directly transferred to the females. Which females means the females who cannot conceive. The female who cannot conceive, for such females we can transfer embryos into the female bodies by this in vivo fertilization. And here in this in vivo fertilization, to transfer embryo directly into female, the female who cannot conceive, we have various methods in vivo fertilization. In that, first and most important method is gift. A gift. Here gift means gamete intra-fallopian tube transfer. Here I am writing. Gift means gamete. Name only suggests gamete intra-fallopian tube transfer. Here gametes are female or egg. Here gametes may be male gametes or female gametes. Like male gametes, sperm or ovum or egg. So these gametes are collected from a donor. A healthy donor, we should collect gametes, either sperms or ovum, and then directly transfer into the female fallopian tube. So this method especially used for female. Hence the name only suggests fallopian tube, because in which we mainly collect ovum or egg from a donor, and then these eggs are transferred into a female fallopian tube of another female. So here the donor and patient is both are different. If patient has some blockage in their fallopian tube, then we can collect only eggs or ovum from those patient, and then we can transfer those gametes into the healthy unblocked fallopian tube of another female. So this is the main concept in this gift, and this gift technique is ideal for, very important, this one, this technique is ideal for this gift technique is ideal for a female who cannot produce ovum but can provide a suitable environmental for fertilization and also for further development of this embryo. Only the problem is the female who cannot produce ovum. In such female only we should and we can collect the egg. This is all about the gift. And then we move on another technique. So that is ICSI. Second one, IC. Here ICSI means intracytoplasmic sperm injection. In which sperm is directly injected into the ovum. Or egg. So reason for ICSI. Why we should choose this ICSI means the male persons has severe male factor infertility. Here male has severe male factor fertility. Why we choose this ICSI method means in which sperm is directly injected into the ovum or egg means there are some persons they have severe male factor fertility. Hence we can choose this ICSI method is the best method for fertility. Then what are the severe male factor fertility? So here severe male factor fertility. There are few factors which added to the male become severe, and those factors are like severe oligospermia. It means that extremely low sperm count. This condition is called extremely low sperm count. Here low sperm count means less than 5 millions of sperm per milliliter. So this less than 5 million of sperm per milliliter is a very extremely low sperm count. Such condition is called oligo. So if the is one of the severe male factor fertility condition. Now coming to second, actino condition. This factor also leads to severe male factor fertility. And what is actinozoospermia? Means poor sperm motility. Which poor sperm motility occurs. Means poor sperm motility means the sperm cannot swim well, in which the sperm cannot swim or move well to reach egg or ovum, and this condition is called echinozoospermia, and this is also one of the factor for severe male factor infertility. And third and the last most important is azoospermia. A means here absent. Means in azoospermia, a complete absence of sperm in the ejaculate. A complete absence of sperm in the ejaculate. A complete absence of sperm in the ejaculate is the main is known as azoospermia. And these are the very important severe male factor fertility. And in this case only we will choose ICSI, intracytoplasmic sperm injection method. Now we move on another important in vivo fertilization method. So that is a fourth one. AI means artificial insemination, in which semen is collected either from husband or healthy donor. In which semen is collected from either husband or a healthy donor, and this semen is artificially introduced directly into the vagina, or we can introduce this semen into uterus, and this process and this method is called AI, artificial insemination methods. Next, last, IUI. Here IUI means intrauterine insemination. So in this method, in which method semen is collected from same either husband or a healthy donor, and these collected semen artificially introduced specifically into uterus. So in this method specifically the semen is directly introduced into the uterus only, but in AI we can introduce semen artificially vagina or uterus, but IUI is especially designed to introduce of semen into the uterus only. So that is a major differences between artificial insemination or intrauterine insemination. In the name only it is suggesting uterine, specifically it given uterine means uterus. Only in uterus directly we can artificially introduce this semen. So this is all about the different types of in vivo method, and also we discuss in vitro fertilization methods. Now there is a quick flowchart for quick revision for ART. We will go through it here. Flowchart for ART quick revision. For quick revision, here I am providing a flowchart for ART. Like yeah. So here ART, there is a one important word ART, which is done only after 2 years. So 2 years of uncohabitation. Cohabili means after 2 years, still if there is no conceive, then only we can perform this ART methods. Here we discuss in ART we have two different important methods, that is IVF and embryo transfer, in vitro fertilization and embryo transfer, and in vivo fertility. So in IVF already we discussed IVF is a fertilization or fusion of gametes outside of the female body. Here in which fertilization outside of the female body, in which we have discussed two important steps methods. They are GIFT method and IUT method. In GUT, here less than 8 blastomer of embryo we can transfer, and the transfer site is only fallopian tube. The transfer of 8 stages of blastomer of embryo only in fallopian tube only. Now coming to IUT, here more than 8 blastomer stage of embryo we can transfer in this method, and the transfer site is only uterus. Now coming to in vivo fertilization, so in which fertilization or fusion of gametes occur outside of within the female body only. And in this method we have discussed several important methods, like we discuss GIFT method. In GIFT method, gamete, that is especially ovum, was collected from a donor and which is transferred into the fallopian tube of another female fallopian tube. And then we discuss ICSI. It is a very important, and this was specially designed for male, and GIFT are specially designed for female. And in this method, ICSI method, mainly choose for severe male fertility factors. Just now we have discussed various severe but male fertility factor. So due to that factor only, and then the persons which will go to this ICSI methods. And also we discuss AI method, artificial insemination, and also I intrauterine insemination, and these two methods also designed for male only. So these are the various ART, and this by using this ART assisted reproductive technology, we can have the solution for in. So this is all about the entire concept of infertility, the reason of infertility, and the cure, the solution for infertility, that is ART. So with this we have completed. Now we have few MCQs. These MCQs are highly important, and all these MCQs are frame based, NCERT based only. So read these MCQs and drop your answer in comment box. So here we go with first MCQs. A children couples visit an IVF clinic. Here the husband has a very low sperm count. Here husband has a very low sperm count. Here this is the keyword, very low sperm count in his ejaculate. When he ejaculates his sperm, and it has very low sperm count, and which assisted reproductive technology, simply we can call ART, is most suitable to overcome these specific issues. So here we have different options like gift, gift, ICS, and intrauterine insemination. So read these four options and drop your answer in comment box. And one more MCQs. Yeah, here MCQ2. Yeah. So in the GIF techniques, what is transferred into the fallopian tube of female? And already we discussed the GIF is designed specifically for female. So what is transferred into the fallopian tube of female who cannot produce her own gametes? The female gamete is egg. Here, female gamete is egg or ovum, but can provide a suitable environment for fertilization. So, which one it is? Zygote, embryo with 8 blastomeres, ovum collected from a donor, embryo with more than 8 blastomeres. So, read these four options and drop your answer in comment box. Don't forget to drop your answer in comment box. So, one more MCQs from this topic. Yeah, here we go with third, and it is a statement type of MCQs. Read the following statement regarding assisted reproductive technology, ART, and choose these correct options, in which we have statement 1 and statement 2. Read these two statements. Statement 1 asking about GIF. Here, GIF, zygote or early embryo up to 8 blastomeres. Yes, sorry, 8 blastomeres is transferred into the fallopian tube. Is it? The statements are right or wrong? So choose it. And in statement 2, in vivo fertilization, here asking, and GIFT is a, already we discussed, it comes under in vitro fertilization, IVF, in vitro fertilization. But statement 2 asking about in vivo fertilization, means fertilization taking place within the female body. And in vivo fertilization refers to the fusion of gametes outside the body followed by embryo transfer. So read these two statements and analyze it and drop your answer in comment box. So this is all about the entire concept of infertility and ART, and relevant to the these three MCQs. So that's all. So this is all about the concept. So thank you and have a nice day. So don't forget to share, subscribe my channel. Thank you.